Hello everyone, I am Dr. Anilkumar Mannava. I am consultant gastroenterologist in Yashoda, Hyderabad. Today on the occasion of World IBD Day, I am going to talk about basic things like what is the IBD, what are the common symptoms a person faces who is having an IBD, how to diagnose the IBD and how to treat IBD. First of all, IBD means inflammatory bowel disease. As the name suggests, it is an inflammation of the bowel. There is swelling and ulceration in the bowel. It is a chronic disease, means it is a long-standing disease. It is not of a short-term disease. In the IBD, there are subtypes, ulcerative colitis or Crohn's disease. In the ulcerative colitis, the disease is limited mainly to the large bowel. In the Crohn's disease, the disease can involve even from the mouth to the anus, anywhere it can involve. So, what are the symptoms a person can face? A person can present with abdominal pain or chronic loose motions associated with mucus, pus or blood in the stool, which is chronic, and he may have vomiting sensation, he may have loss of appetite, easy fatigability, and other symptoms like early breathlessness, joint pains. All these symptoms can be there. So a person, if he is having this, he should be subjected for further investigation to look for features of IBD. What exactly causes this IBD? There is an interaction between our dietary factors, genetic factors, environmental factors like infection, which lead to alteration in the immunity. Our altered immune response leads to damage of our own intestine. This leads to the inflammatory bowel disease. As this is immune dysregulation, this immune dysregulation can even affect other organs in the body also. So IBD is basically not only a GI disorder, it can even involve other organs also. So how do you diagnose the IBD? Once a patient presents with these symptoms, we suspect clinically, then we subject them to few tests, like first lab test we do, and then stool test, radiological test, endoscopic evaluation, and then biopsy. In the blood test, we do basic CBP and CRP. CBP is complete blood picture, CRP is C-reactive protein. In the stool test, we do markers like fecal calprotectin, and in the radiological test, we do imaging like ultrasound abdomen, CT abdomen, and we do endoscopic direct visualization of the mucosa of intestine, and we take biopsy from the abnormal site. We subject that to histological examination under microscope. So all these put together, that is clinical presentation of the patient, the clinical examination, and combination of lab tests and pathology, all these can diagnose the IBD. It is not any single test cannot diagnose IBD. It is a combination of the above investigations. So once we diagnose the IBD, we need to know few things like what is the severity and what exactly is the IBD. I told you already there are two types. Which type of IBD is this? Is it ulcerative colitis? Is it Crohn's disease? And what is the extent of involvement of the intestine? So why we need to know is because the treatment depends on this. Then coming to the treatment is multimodality approach. That means it involves multiple specializations like gastroenterologist, GI surgeon, dietitian, and a physician. So all these combinedly manage a patient of IBD. And apart from the medication, lifestyle modification, dietary modification is important for controlling the IBD. In the treatment, the medication part, there are basically few classes of treatment like the salamine, then steroids or immune regulators, and then biologicals. So there are two approaches. One is a step-up approach and the other one is top-down approach. The step-up approach we give in the less severe cases. In this, we start with the basic drug, we assess the response. If there is no response, then we step up to the next level and again assess and then to the next level. Finally, the patients who are refractory to all these medication, or in those patients who present with severe symptoms and who are having complications like perforation of the bowel, them we subject for surgery. The second approach is top-down. Patients who are having more serious disease, there we start the injections first, either biological agents or steroid injections. Then based on the response, we come down on the treatment. Again, in this also, the patients who are refractory to the treatment, them we subject for the surgical management. In the surgical management, they do resection of the involved GI problem. So please remember again, IBD treatment is a long-term treatment, adherence to the treatment is important, and multidisciplinary treatment is required. Thank you.